our today's speaker. Will Dow, I have another exciting announcement for those who don't know this, is now a member of the Department of Demography. He was voted as a new member last year, and it took a little while for the gears to grind. And so he is now joined. So that's wonderful news for us. He can serve as an internal member, and Will and I were just discussing this. Maybe he can still serve as an outside member on the Dissertation Committee. We'll see about the technical details of that, but he's part of the department now. The only disadvantage I can see to this, first of all, we're delighted that he accepted the position, which comes with additional responsibility and work and no rewards other than the title. But the only disadvantage is Will has been a really strong advocate for demography at Berkeley, and now he will no longer be such a neutral, he's losing his neutral stance, he'll become an insider. So Will is part of our series of, in response to our huge big cohort, we're having a lot of internal speakers this year, and I'm really happy that Will agreed to speak to us despite taking on a surprise appointment as interim dean of the entire public health school during their move and many other things. So thanks so much for coming up. Will got his PhD in economics at Yale, then he did a postdoc at Rand, who has then, and still does, has a really active group in labor and population. Then he was a professor at North Carolina, Chapel Hill, before coming here in about 2004. One of the big things that Will did when he came here, he says, hey, how come we don't have a pop center? So it's really thanks to Will asking that question, and I think probably ghostwriting most of our initial application when Mike was PI, that we have the Berkeley Population Center, and he's currently the director, he's associate director of Berkeley Population Center, and he's the director of CEDA, the Center for the Economics and Demography of Aging. I don't want to take more of Will's time, so I'm just going to let him talk about his paper today.
Great, thank you so much. And I will say that one of the attractions of moving to Berkeley was this outstanding Berkeley demography community. So I'm thrilled to be formally a part of the community now. Look forward to, I haven't actually met all of the new cohort of students, although you're not so new now, so I look forward to getting the chance to do so going forward. I have a few more months as interim dean of School of Public Health, and then I will return back to being a regular faculty member, and look forward to doing so I'll get to spend more time on my research, etc., which has been a little bit hard to squeeze in this year. So the last few times that I think spoken to this group, I've spoken about some of my aging research, and I'd love to talk to folks about that. Been have a long-standing project in Costa Rica looking at healthy aging in Costa Rica, and we've started some comparative work in Cuba now, which a collaborator presented a few weeks ago at the Mortality in Low Middle Income Countries mini conference that we had here at Berkeley. So I decided not to talk about that since a number of people here already just saw that work, and I decided to talk about something which is more under my sort of pop center part of my portfolio, and this is around paid parental leave. So can I ask how many people in this room have actually taken parental leave? Okay, and how many people were paid during that parental leave? Okay, so a few of the lucky ones here. It turns out that the United States is virtually the only industrialized country in the world that doesn't have a policy of paid parental leave for new parents. And many people describe that as sort of a travesty. It goes along with our underinvestment and many other dimensions of human capital, particularly human capital in the very early parts of the life course. So this particular project is looking at an innovative attempt in San Francisco to expand the support for paid parental leave. And I'll tell you more about the particulars of the ordinance that San Francisco passed. And this is really an early presentation as part of this project. We've been trying to dig into many dimensions of this since it was passed and went into place 2 years ago. And we're just sort of starting to write the papers now. So this is a great time for lots of sort of feedback and ideas. And we're at a point right now where the governor has embraced the potential for some radical expansions of paid parental leave here in California. So there's a lot of policy interest in this right now, which could be good or bad depending on how it's actually done, but it's also great from a research perspective as we start thinking about what should we be putting in place to really learn from this, what California may be doing. So that's sort of the spirit that I've been digging into this, this project. So I want to acknowledge, first and foremost, my co-authors, collaborators on this. Julia Goodman is essentially the co-PI. She's a former Berkeley demography trainee, is now faculty at Portland State, and Holly Elster is a PhD student in public health who is just working on this, and all the slides that you'll see are thanks to them. In my current role, unfortunately, I don't have a whole lot of time to make slides, so when you have questions about why the heck does that say that, I'll say, let me ask them and I'll get back to you. Whoops, this is jumping. I don't know why it keeps jumping. Also, thanks to the folks in San Francisco at the Office of Labor Standards Enforcement who have been super helpful in thinking about what's going on the ground in the city, as well as some folks in the advocacy community, particularly Legal Aid at Work, who've really sort of helped me understand how this is working for real parents out there in the community, and particularly working with the employment community about how to do this. And this is all supported by funding from the Robert Wood Johnson Foundation. Initially, they approached me to apply for a research grant to actually evaluate what was going on in San Francisco, and so we got a grant, we started that, and then we were able to get a larger research hub on work and family support that's joint between Berkeley and Institute for Women's Policy Research in Washington, D.C. And that's supporting a number of research projects around paid family leave, Danny's work on flexible sort of work scheduling, some work on minimum wage, work on EITC. So a number of different projects, the faculty around the campus are working on this, and there's the opportunity for more projects. So if you're doing work in this area, certainly let me know. We'd love to just keep building up the critical mass that we have at Berkeley, thinking about these policies at the intersection between sort of work and family. So this was in April 2016. San Francisco passed a new ordinance. It was called the Paid Parental Leave Ordinance. It got a lot of press locally and nationally because it was the most far-reaching paid parental leave ordinance in the country when it was passed. And it's still, I think, the farthest reaching, although there's a lot of discussions about state level efforts in New York and Pacific Northwest to try to build on this. So I'll give you a little bit of the details about this in a moment, but let me just start with some background on paid parental leave. And I don't want to spend time on a full lit review. There's a lot of people who have been trying to understand what the benefits are of paid parental leave, the positive effects. So there's a whole health literature on this that shows with longer leave, paid or not, if you have parents taking longer leave, breastfeeding continues longer, kids are more likely to be fully immunized, reduced postpartum depression among mothers, there's effects on sort of infant mortality, and then there's a handful of studies, and I think we could really build out this evidence. The ghost in the machine. Around child development effects. So there's reduced behavioral problems among children and once they sort of reach school, if their parents have had longer leave or if they're in places where there's strong leave policies. And these are sort of quasi-experimental studies. And again, you can nitpick about the particular studies, but certainly all the studies seem to be pointing in the same direction. There's some interesting work looking at reduced high school dropout and eventual sort of wages once people hit the labor market. And these are really sort of long-term effects downstream. There's also work which looks at the effect, particularly on mothers returning to the labor force and returning to the same job. So there's some really good work in California, sort of Chris Room, Maya Russen-Slater, Jane Waldfogel, and that group has been doing some excellent work looking at this sort of increased labor force participation for mothers, which it's giving them the option to return to work if they want to, and so clearly sort of welfare enhancing, and you're not forcing them to go back to work. Though there are very incomplete job protection laws, both in California and throughout the country, and that makes it harder for some types of folks to be able to return back to work. Overall, there's about 4 million workers who take parental leave each year. The vast majority of those are unpaid. Among private sector workers, only about 13 to 15% have paid leave through their jobs. Then there's an incomplete patchwork of state and local policies around income replacement for paid leave, but it really is sort of quite embarrassing for a high income country. There's been some discussion about what the optimal length of leave taking is as well. So some of you may have seen the press articles a month or two ago about the Gates Foundation had experimented with a year-long leave policy. And recently they decided to dial that back to 6 months because they found that they're much less likely to retain those employees at Gates if they're taking a full year off. And so the reporters were sort of calling me up and saying, well, isn't this long leave taking a bad thing? And I said, well, Gates Foundation tries to take a perspective from the larger social good, but they're also an organization that's trying to do their business. And from a social perspective, what I see is the big potential benefit of leave taking is not just supporting the parents economically if you have paid parental leave. Right? It's not just about some of these early behaviors. We know these are good, but it's really if we're seeing these long-term benefits. Right? So we are underinvesting in so many dimensions of human capital early on in the life course in these critical windows. And this is, to me, what I see as the big potential payoff. And I'd love to see more work around this. I'm not going to get to that today. What I'm going to do is just tell you what's been going on in San Francisco, really digging into the meat of one particular policy and how that's changing offering by employers in particular, and a little bit about mothers.
What do you think is the mechanism that might link just those first few months to these long things? Is it then a cascade of kind of positive things, or is it actually that?
I think it's a cascade of positive things. It partly is that bonding at a time which sort of goes along with all of this. Yeah.
I think the relative, maybe a little later for estimation, but there's a narrative right now that the lack of paid leave is maybe depressing fertility. So do you see is there any evidence of that? Is that something to worry about?
There's no strong evidence about that. I know Josh is our fertility expert, right? I don't think, if we look at European countries, so you have generous paid leave policies in many Western European countries, and if we look at the low fertility there, I don't think that expanding further paid leave there would help. Would it help in the U.S. if you go from nothing to something? Maybe. I don't think that's really what's going to drive fertility change in the U.S., but it's a fascinating question.
I think there's a lot of kind of timing effects on these leave things. So people optimize their return to work and those type of things. So that might also have important consequences for child spacing and child well-being and that sort of thing. But the actual level of fertility, we don't think as much.
Yeah, we are.
So the 4.2 million workers taking parental leave, so there's fewer than 4 million births, so do this
Mothers and fathers.
Mothers and fathers, and does it possibly include like not infants, but other older kids?
No, this is, I think that statistic is just around parental leave, right? Usually it's the first year. Most of the policies are on the first year of life, but virtually all of the leave taking among mothers happens right away, and the fathers within the first couple months.
Okay.
Yeah. So if we look at the U.S. Evidence, so there are a bunch of policies that have allowed for unpaid leaves. For example, the FMLA. Which allows 12 weeks of unpaid leave without losing your position as long as you're in a covered employer with at least 50 employees, blah, blah, blah. We found that those policies increase the share of mothers that take maternity leave, but it's very much patterned by socioeconomic status. So, if you are working at sort of minimum wage, then you just can't pay rent and taking unpaid leave. Even partially paid leave. So California currently has policy of paid family leave. When it was phased in the early 2000s, we saw the average leave taking by new mothers increase from about 3 to 6 weeks, which is great, but it's still only sort of 6 weeks on average. Wow.
So, could you fix his presentation so it doesn't dance?
And again, that partially paid leave was much more likely to be taken up by higher socioeconomic status folks. And if we look at parental leave taking among lower SES parents, it still remains much much lower than higher SES parents. Thank you. So here's sort of a busy slide, but this is the paid family leave policy in California that was phased in 2004. What it does is provides up to 6 weeks of 55% wage replacement. And I'll tell you a little bit more about those details in a minute, but it's done through state disability insurance. What San Francisco did was say, for employers, starting initially with those employers with more than 50 employees, then it phased into employers, private sector employers with more than 20 employees, said that the employer will need to fill in the gap between what the state is paying and the 100% of wage replacement up to some maximum sort of earnings level for 6 weeks of bonding leave. So this is not expanding the payroll tax to pay for this. This just told employers, if you have an employee who's going out on leave, you're going to have to make them whole up to 100%. So those numbers aren't coming through very well, but the further complication is, for a normal vaginal delivery, women get 6 weeks with disability leave. So that's only for birth mothers. The other parents don't get that. In 2017, that was set at 55%. A recent change in the law in 2018, that went up to 60%. And then for lower income families earning up to $400 a week, it went up to 70% wage replacement, which is much better than 55%. But still, if you're earning less than $400 a week, are you going to be able to pay the rent on 70%? It's an empirical question. My prediction is a lot of them just aren't going to be able to take that leave. So that's the first 6 weeks, and that gets extended to say 8 weeks after a C-section. And then what California does is you have another 6 weeks after that of bonding leave. And not just the birth mother, but all parents are eligible to take that next 6 weeks of bonding leave. And again, that was at 55% initially, and then it was phased up to between 60 and 70%. That bump up to 60 to 70% is scheduled to expire in 2022, I think. So there'll be some discussion about whether the state wants to keep doing that if it doesn't get superseded by some other policies. So is that clear what the state did? And then this is the amount up at the top is what San Francisco employers are required to add in. Yeah.
So this has to be taken consecutively.
It does not have to be taken consecutively. It typically is. And again, the non-birth parent can take that 6 weeks whenever they want, if they're going to take it within the first year, I think it is.
But the San Francisco law is talking about that bonding time, or it's talking about any time between.
So the San Francisco law is only that second portion, the bonding portion. So the San Francisco law does not require to top up during the first 6 weeks of disability leave. And there's a lot of discussion about why they did that. So was it done to save money, less of a burden of employers? Is it done because virtually all mothers now are taking that 6 weeks anyway, so it wouldn't functionally have had any difference on outcomes? When I've spoken with folks about it more recently, they say it's actually only a small part of all disability claims have to do with new parents and childbirth, and changing this just around the childbirth just got complicated. So anyway, right now it's only that, like after a normal delivery, say that week 7 or 12 that you get 100%.
Could you not take the disability but then take the
In
bonding?
theory, you can. I've sort of asked that, but nobody sort of does it, and partly because people don't understand the nuances. But yeah, it's just people aren't doing it. Yeah.
Both parents are eligible for both of these?
Well, this is only for birth
Only for
mothers.
the women.
The disability is only for birth mothers.
Okay.
And then the birth mother and
The partner.
another parent is eligible
So
for.
you still have the pay the
bonding.
rent problem in the first 6 weeks.
Sorry, you still have the.
Pay the rent problem.
Yeah.
Yeah, okay.
Yep, but virtually all families are doing this now. I'll show you some data in a minute from San Francisco. It's not all, but many of them. So what I'm going to do is we've been collecting data in a bunch of different ways. One, we did a survey of new parents in the Bay Area, both San Francisco and surrounding counties, of mothers who gave birth in 2016, and we asked about their experience as well as the other parents' experience. So that was sort of pre-law, and then we have some post-law data which is sort of in process, so I don't have any of that here now. We have semi-structured interviews with a bunch of key stakeholders about how this was actually playing out on the ground. We have.
This is all Julia, she set this little trap. for
She
you.
probably did, yeah. Make me do all that work putting together the slides, I'll get him.
Maybe if we just go up the sides, he'll just move them forward
Full screen,
manually.
I think. Don't try any slide mode.
Those are big, that's big.
That's big.
Now, would you rather?
They'll be smaller, there'll be stuff that's hard to read in a minute.
So you're
Good, we
just,
don't see your notes. You can get rid of that.
Yeah, if you can read the notes.
Yeah, if you
Uh,
put the thing on the bottom, it's great.
Duration.
Ah, okay.
There you go.
So that's
3 minutes, give him
infinity
3
somewhere. I
minutes.
get 3 minutes on this one.
No, infinite, infinite.
Yeah.
Not, or, yeah.
2 minutes, 45 seconds. So then we did a set of in-depth interviews with some San Francisco employers in the summer of 2017. We have a bunch of data from EDD, the California Employment Development Department, around the administrative leave taking, and then we did a survey of Bay Area employers in 2018 to get some sense of their perspective at that point, with retrospective information about changes in policies. So first, let me just give you a couple nuggets from what we heard from mothers. Essentially, you can just focus on the right-hand side here. This is what percentage of mothers in San Francisco are taking at least 6 weeks of leave by income status. And you can see that for all those above, say, $32,000 a year of household income, virtually all of them are taking at least 6 weeks of leave. We do have about 20% of those at lower income that are not even able to take the 6 weeks of leave, and that absolutely gets to what you were just saying, Danny. And now, some of these may be in non-covered households, they may be sort of in informal employment, et cetera, but this was among those who are reporting that they're employed mothers. And so 20% is non-trivial, not even taking 6 weeks.
So this could be, you could be working for a small firm that wouldn't be required?
So again, this is before the San Francisco law came in, so this is, they could be working for firms that are not part of the state disability insurance program. There's a set of companies that for various reasons aren't part of it, but the vast majority of companies are part of it. So I think it's just an income issue, really. You can't pay the rent on 55% a wage replacement for that full 6 weeks.
Freelance contractors, are they counted as employed but not?
For this, no, I don't think that they would be included in there. I think that we excluded them. I'd have to double check with Julia and Holly. And so this is, if they did receive pay, where they received their pay from, or well, whether they received any pay at all. So this is again by income, and we see that of those lower income folks, only a third of them received any kind of payment for their leave from some government source, like SDI. It could be that they were confused about where SDI comes from, so that's, it could be sort of underreported. Again, this is whether they received pay from their employer, though. So this is in San Francisco, the most progressive cities in the country, and 25% of the lower income women, and really only half of the women at above $97,000 annual income are getting any paid leave from their employers. Of those that are getting paid, most of them are getting, well, half to 2/3 are getting it for at least 6 weeks. In terms of the replacement rate, very few of the lower income women are getting paid for at least 50% of their wage replacement. So this is it's a pretty big issue. Then we asked a hypothetical question, because it's fun to do that, you can on a survey. We said, if you had been offered 12 weeks of fully paid leave, how much would you have taken? And some people say, well, there's some folks who they don't want to take that much leave. Okay, fine, that would be captured. And some people say, well, they're scared that they wouldn't have job protection. So let's see how much this is related to job protection. And we do see that among the lowest income groups, even at 100% fully paid leave, about a quarter of them said that no, I wouldn't be able to swing 12 weeks leave. So I think that's people who are scared about their job protection, frankly. And again, there are some legal protections. Some of these folks don't have legal protections. Some don't know they have legal protections. Some have legal protections, but they don't think their employer would respect it. We know there's an issue with a lot of undocumented groups who have been not had their employer rights respected, etc. We do see that among the higher income groups, 98% of those making over 97,000 said, of course I'm going to take my 12 weeks. Yes, I love my work, but I'm going to take my 12 weeks. That's interesting. All right, so I'll just quickly go through some results of talking with some of the stakeholders about what was happening on the ground when San Francisco's ordinance rolled out. So, did anyone hear about it, right? And is actually going into place. So the overall impression among lots of stakeholders, and this included both the parents advocates, and it included some of the employer advocacy groups, et cetera. And the overall impression was very positive. The labor groups and the government were actually surprised by the lack of opposition from the business community. So in a previous study that I'd done looking at the San Francisco Healthcare Security Ordinance, which required firms to, it was essentially a pay-or-play insurance ordinance kind of thing. It required firms to pay towards health insurance for their employees. Had a lot of backlash. Right? The Golden Gate Restaurant Association was actively campaigning against it. That didn't happen around paid parental leave, which was sort of fascinating to me. Partly there's sort of a lot of outreach and education efforts. There was a long process around the making of the ordinance. So in San Francisco, that seemed to work out well. How this would work in other places, who knows?
Is part of the logic that the firms feel that they would like to give their employee paid leave because the employee wants it, but they're happy that their competitors have to do it also, and so they're...
Yeah, and I'll show you some data what the employers are actually saying, but that is part of it. So among those that are offering paid leave, they want their competitors to be offering it too, but baseline, it's only a small share of employers that are doing it. But there is sort of a game theory aspect to this, that the Nash equilibrium is that no one offers, except at very sort of high-end employers that are trying to attract highly skilled employees, and that's what we see. We see in Silicon Valley, we see a bunch of offering, and then most other firms just aren't offering. So here's an advocacy group. This is the former aide to Supervisor Scott Wiener. Was talking about there was never any strong opposition. They worked through the legislative process to ameliorate concerns, etc. So they had a phase in for the smallest businesses to give them more time to sort of adjust. So it was done in a fairly thoughtful way, and so it's nice to see that something can get through, at least in San Francisco, without a lot of opposition. This is calls placed with either questions or They could be complaints, but it turns out these were virtually all questions to the Office of Labor Standards Enforcement. So once it actually kicked in January 2017, they had hundreds of calls a month by firms trying to figure out exactly how they do this. So that's good. People knew about it and they were asking about it. There was an annual reporting form as part of the Healthcare Security Ordinance, and the city added a question in about whether or not they were knew about the paid parental leave ordinance and what they were planning to do about it. And it was a very high response rate among firms that actually knew about it and were saying that they were the firms that should have already been covered. Virtually all of them said that yes, we put this into place. We know about it, which is good. But there were a lot of challenges in implementing it. I won't go through all the details, but employees have multiple employees, those with tips, how exactly to calculate the benefits. It was really complicated, actually, the way that it was done. So then, talking with some of the employers, this was in summer 2017. This was just a dozen employers from different sectors, and we tried to talk with someone, sort of the head of HR kind of equivalent, who knew something about what was going on in the firm. And so we asked them to talk about both the positive and negative aspects of PPLO. And turns out that these people that should have known about it, and it was really variable what they did know about it. Again, many were still expressing, this was 6 months into it, a lot of uncertainty about how you would actually do these wage calculations. And partly that's because in smaller firms, they hadn't actually had someone go out on leave yet. And so they hadn't had to go through it. But even those who had to go through it were still really confused. So they didn't even know whether both parents were entitled to the leave, right? It's really basic things that they should be able to counsel their employees about. They were unclear. The concerns about tips and how those get calculated by someone who's in a sort of restaurant was a concern. Overall, the respondents sort of said, well, yeah, they think it's going to have a positive impact on their workforce, which is good to hear. This firm would say that they've been looking into trying to provide these some kind of benefits anyway, but they just, this policy helped them sort of get there and gave them that nudge to actually sort of make it happen. And then there were concerns about the cost of it. This is one of the big concerns we have, both about the cost of providing for the paid leave, but also the administrative burden associated with making this happen, the way that it was implemented. You're really putting this on the employer. So here's a pharmacy owner, relatively small business, but still covered, and they're saying, we're parents ourselves. We think this is really important, but they said we'd much prefer to see it on a broad-based small tax, essentially increasing the payroll tax rather than doing it through this sort of cumbersome employer mechanism, which it's hard for the city to sort of add a payroll tax, but it's something you can do at the state level. So I'll come back to that in a minute. All right, so now let me just show you some, any questions about that?
How should we think about this San Francisco sample? These are people who want to give a positive impression, of course, that they're interested in the parents, and there are also people who are desperate for employees during this period.
Yeah, this was a period of very tight labor markets. But like I say, I think at the higher end firms, they found a way to make it work. At most of the firms, they say in theory, yeah, this is a good thing, but I'm not really going to do it until someone pushes me to do it. Okay? So now let me just show you some numbers from the Employment Development Department, and I was hoping I'd have updated numbers any day now. We're going to get updated numbers from EDD through more of 2018, but I don't have those here. So what I'll show you is data from the initial first the phase-in from the 2016 pre-period and then the 2017, essentially the first year of implementation. How many people actually were taking bonding leave? And so they have the statewide data, and they were able to release to us the San Francisco specific data, along with data from the surrounding counties, so we could do essentially difference type comparison. It's not sort of a big N, and it's one county intervention, so we have to be careful not to overinterpret. And so I'll show you, yeah.
So is this about where the employees live or where the employers are located?
So that's a good question. What we have here is where the employee lives. We've been trying to get from EDD the link to the employer. Turns out that they have a wall between the employee data and the employer data, and nothing shall pass between. And they want another $100,000 for us to be able to pay for their analysts to be able to crosswalk data across the hall. But that's where we are now. We're grateful that we have this data. We have some information from our mother survey of how much border crossing there is, and so there clearly is some. But the ordinance itself is about where you work. The ordinance is on employers.
And we think San Francisco is the only county that has anything like this.
Yes, we know that they're the only one that has anything.
So the other counties are the same.
Right, the other counties are just covered by the state law, and they haven't adopted something like this. So here, I'll just focus you on sort of San Francisco. This is female bonding, and this is male bonding. What this is the percentage change from Q1 of 2016 pre-law to Q1 of 2017. Here's the same comparison for Q2. So this is San Francisco. This is the composite of the other Bay Area counties, then Sacramento and some of the other urban counties in Southern California and the rest of the state. So what we see in, say, the rest of the Bay Area, and partly this could be spillovers, but we're seeing that for female bonding claims, they essentially didn't move, and they didn't really move statewide. So if there was a huge spillover story, then we should have seen at least bumping up of female bonding claims in the Bay Area. Now, partly there's a ceiling effect because the vast majority I'm sorry, let me take that back. This is only for the bonding piece, that second set that I showed you in the graph. This is not the disability claims. So there isn't a big ceiling effect on this. Sorry. So we're just not seeing movement in these bars around females, whereas in San Francisco, we saw that in Q1 there was maybe an 8% effect. If we take the Q2 data, there's maybe a 3% effect. And we're getting the data much farther back now and farther forward, so we'll be able to do more adjustment for trends and that kind of thing. But it looks like there's some effect for females, but it's not huge, right? It's nothing to sort of write home about.
Points or percentage?
These are percentage changes, not percentage point changes. So there's 8%. There was 8% point, so it's a smaller than a percentage point increase. And then this is for male bonding. On average, about half as many males as females make bonding claims. And what we see is that in San Francisco, there's somewhere in 23% increase in bonding. By Q2, that was up to 33%. But again, we'll want to smooth over a much longer period when we get sort of more data. In the rest of the state, we are seeing bumps up though in male bonding claims statewide, which is sort of fascinating. And I think that partly speaks to how much this has been in the news lately. It may speak to the economy as well, as the economy sort of keeps strengthening. Who knows exactly? And again, with longer period, we'll be able to say a little bit more about that. But it looks like the main quote-unquote beneficiaries of this so far have been parents taking more time for bonding, which is great if the fathers or the second parent is actually helping out at home. And we know from other types of leave-taking studies that often when fathers take that leave, they're not actually spending as much time in bonding and caring for the newborn.
I'm just confused about the numbers here.
Yeah.
If the fathers go from 4% taking leave to 5%, that's a 20% increase?
Yeah, let me show you actual, this is the number of bonding plans in San Francisco.
Okay.
So this will be helpful. So if you compare Q1 2016 to Q1 2017, you can see that the female bonding went from 850 to 924, about 74 more women in San Francisco. The male went from 447 to 553, so 106 more fathers in San Francisco in Q1 were taking leave. So it was an absolute much bigger change for fathers than for mothers. It's even bigger in Q2. Okay.
The 100% is there's no cap on it. If I'm making $10,000 a week, I get $10,000 a week?
There is a cap. It's around $104,000 annual income, something like that. Yeah, it caps it up. And that's based on the SDI rules. San Francisco didn't make this up. They tried to match the SDI rules as much as they can. All right, so then in last summer and fall, we went out and we surveyed Bay Area employers. This is from a sample of about 300 employers. There were employers in San Francisco, 20 or more employees, private sector. We stratified by industries that are higher wage versus industries that are lower wage, like accommodation food services versus retail, where this is lower wage ones. And then we matched the non-San Francisco counties based on those same sort of characteristics, and we sort of weighted back as best we could. Didn't have a great response rate, which happens in these employer surveys. There's 20-something% response rate, so you have to take all this with a little bit of grain of salt. But that's what we can do. So we asked them, how familiar are you with the paid parental leave ordinance? And we see that there's a handful that really don't know much about it at all. The vast majority say that they know something about it, but maybe not super expert in it. Then we asked them about their whether or not they offer paid parental leave. And so here's the sort of surrounding counties, and here's San Francisco. So even in 2016, you had 44% of the San Francisco firms in our sample said that they offered paid parental leave to at least some of their employees. 31% in the surrounding counties. So San Francisco already was more likely to do some offering. And then this is by 2018, so post-implementation, the surrounding counties had gone from 31 up to 45%. That was a big increase. And we've been talking with Jane Waldvogel's group at Columbia that's doing a statewide survey around of employers around paid leave offering, and they haven't released these data yet, but it sounds like they're finding something similar, that there's actually an increase in paid leave offering statewide. In San Francisco, though, we saw this went from 44% up to 75% offering leave. So it's a pretty big jump.
There could be big differences in the quality and the details of how these parental leave, right? Because this is all privately offered.
These are all private firms, and this increase in San Francisco is going to be in response to the ordinance. So it has to be 100% wage replacement, for all of their employees, etc. So yeah, there's likely some differences in
Just understanding the setup. In San Francisco, after this law, what are the other 25% doing?
So we're still trying to understand what this is. Some of this may be size misclassification. So we went down to, for example, size 20, but the firm size fluctuates, and we tried to ask about their sort of nationwide employment, which is how the law was supposed to be written. Some of them may not understand that that's how the law was written. They think, well, I'm an establishment of 10 people in my franchise, I don't have to comply, and they actually did have to comply. Some of these maybe, we measured them at 25, but actually that was just a misestimate.
But the law says this should be 100%.
It should be 100% if we were classifying firms appropriately by eligibility.
People could also be non-compliant, right?
And there's some degree of being non-compliant, and this was not an official government survey. We're very clear this was sort of a research survey from Berkeley. So if we look at the sort of offer rates, I'll just show you the sort of crude difference calculation. It's essentially a sort of 15 percentage point increase in San Francisco if you just take the standard linear difference at 2 points in time. And it's statistically significant, it's substantively significant. It shows, it seems like there was something really going on. If we break this out by employer size, we can see that it's not all due to misclassification, because even among the largest firms, we see that only 83. I'm sorry. So this is among firms that did not offer any leave in 2016. So this is what percentage of those started offering leave. So 83% of the largest firms that were not offering any leave in 2016 were offering by 2018. So this is not size misclassification. These are 17% just either they're not compliant, or the person we talked to didn't know that they were compliant, or maybe they were actually nonprofit or government somehow and they got misclassified. But anyway, the point is, if you look over in the right-hand column, these are essentially the difference numbers with p-values. So virtually at all of these size classifications, we're seeing a significant increase in leave taking for all sizes, which is nice. But then we asked about this cut by lower wage industries versus higher wage industries, and we see that there's a much bigger effect on the sort of higher or non-low wage industries than in the combination food services and retail. So that's certainly a concern that it's the predictable industries where this isn't happening, but it suggests we need to do some targeted outreach if they think they want to make this happen. And from the perspective of analysts, that should start setting off some bells about what's the likely impact on low-wage workers, right? It's not going to be quite as high. And then we looked at those groups that already offered some leave, and we asked whether they had expanded the generosity of their leave after the law to come into compliance. And what we saw is that there were some size groups that seem to have expanded the generosity of their leave, but they're not really super precise statistically as we look at these differences across these groups. But if we look by low wage, non-low wage, we do see that it was the low wage firms that had some kind of leave offering, and it might have been to some of their executive employees or something. But in San Francisco, the low-wage firms were now much more likely to have expanded somehow their existing leave policy. So, and that's sort of the bad news, good news story, that there was some more expansion in San Francisco, at least for those firms that had been doing something originally. The law sort of kicked them into a little bit more compliance. So then we asked them about what they might have been doing in terms of compensating responses, how they're actually making this happen that may not be sort of intended effects. So a few firms said that they were reducing sick or leave vacation time to finance this, but really less than 10% of firms that they were converting paid time off, decreasing fewer raises or bonuses. A handful of the smaller firms said that they're doing raising prices, and about 30% of the small firms said that they were raising prices to really pay for this. And this is consistent with what we saw with the pay-or-play mandate for healthcare, that these were smaller service-oriented firms that are essentially providing non-tradable services. So you can pass the costs off to the customer without them essentially going to a restaurant across the bay or something, right? So you do see that that's how they were paying for it. I mean, the money has to come from somewhere, and these are low-margin businesses often, and so it looks like a good chunk of them were being passed along to the consumer.
Is the changing hiring practices, is that legal?
No, generally not. And so only a handful of them admitted that they were doing something. In our qualitative interviews, we asked whether they had heard of other firms changing their practices, and they all said they worried about it, but no one sort of had the smoking gun that they were trying to avoid women of childbearing age. This is the big concern when you're putting the cost directly on the firm. In terms of the effects of complying with the ordinance, this is broken out by size, but they're relatively similar effects. So looking at these smaller firms, they're reporting some improvements in morale, not huge, but some chunk of firms reporting improvements in morale. Not much effects on sort of customer service or productivity. Some profitability. There's some chunk of firms down here, about 8%, who said that this is reducing their profitability. And in terms of retention, that's where we're sort of getting the most numbers. About 20% of firms think that this is improving retention. So this is sort of good for them in somehow. So on balance, if this were a scorecard and you just added these up, you would say, well, on balance it looks good. Now you can put different weights on these things depending on what you think is most important. We also asked about the difficulty complying with the ordinance, and 40%, close to 50% of firms said that it's been very difficult, or at least somewhat difficult, to figure out how to do this administratively. It's just a complicated setup. I'll just skip over the quotes on that. But then we asked the question, overall, what is your level of support or opposition to the paid parental leave ordinance? And so this is sort of the summary statistic in some ways of how I would weight up all of those other considerations. And what we see is, even among the smallest firms, 50% said they're very supportive. None said that they were very opposed. We only had about 4% that said that they were somewhat opposed.
But these are answered by employees, right?
Yeah, it's their HR person.
Yeah, so they're also employees. They're actually the direct beneficiary of the policy as well as the...
Yes, but we're asking them to respond on behalf of their company, not their own personal life. And so, does your firm support this? But yes, they are real people, but so are the owners of a lot of these. Now, the corporate owners, not necessarily,
Yeah.
but
they're not.
and certainly the people in HR who are having to figure out, where the wages are coming from, how this is hurting and helping, how you're backfilling employees, which really hits HR hard. Even among the larger employees, less than 10% are saying any kind of opposition. So the firms are, at least the ones who responded to our survey, are saying that they're strongly supportive of this. One reason why they might be supportive, and then I'll wrap up in just a second. We just did a sort of quick back of the envelope calculations at how much it actually costs a firm to pay for this. So here if you focus on the first two columns, the first one is employee at the maximum eligible weekly salary, $2,200 a week, so $100,000 something annual income, and then an employee at minimum wage in San Francisco. Let's assume they're working 40 hours a week. There's that wage, the total salary over the 6 weeks of leave. How much the employers, we're assuming the employers are responsible for paying 40% of that. So the employer cost for a leave is somewhere between $1,400 and $5,300, depending on the wage. If we assume that about 2% of workers are taking bonding leave every year, which is not an implausible assumption for the average firm, there are going to be some firms which are different, then really the leave cost as a percentage of payroll is, we're talking about 0.1% of payroll essentially, which is what it's consistent with some of the estimates that I've seen around what it would cost California to actually expand the state disability insurance up to 100% wage replacement to pay for this. It's the equivalent of adding between a penny and 5 cents per hour wages that would pay for this benefit. It's just really not huge in the big scheme of things, which is partly why I think we don't get a huge amount of opposition, but it begs the question, why are we the only industrialized country in the world that hasn't figured out it's only a penny an hour for low-wage workers to do this? So, there's discussion in Sacramento now about what we can, what we might want to do about this. Just to summarize, again, for mothers, we see these huge income disparities in accessing leave. Women say that they want more leave. Employers, a lot of difficulty understanding it, but the employers did comply for the most part with the ordinance. and they're supportive of it. So from the perspective of California policy, I think we could say that, leave is affordable and it's supported by employers. Expanding paid leave through the existing paid family leave bonding program would be way simpler and would be much more supported by the employers than doing this through this sort of kind of mandate. And what we're really trying to understand is, well, what's actually happening to leave taking among mothers, low-income mothers in particular, in response to this. And so that's what we're sort of working on as next steps to this. And then we're talking with folks in Sacramento about costing out what some of this would be, and then if there is a major policy change, we'd love to get into the fields to really have a much bigger N in sample to be doing some quasi-experimental analyses where you could look at some of the more interesting demographic effects of this in a huge state like California. So I will stop there. We have a couple of issue briefs posted on our website, but the publications aren't out yet. So, thank you.
Thank you, Will. We have time for questions.
Is it fair to say on all things considered that this policy, while cheap and popular, does a good job in that all newborns will get a little bit more parental attention, but it's going to benefit the well-off more? So in terms of equality of opportunity for newborns, this is not a real...
Well, I think that's the real question. The existing policies of partial wage replacement have been documented to have affected better off parents and led to more leave taking by better off parents. So the real hypothesis here is that once you bring it up to 100% wage replacement, then we're going to see catch up among the lower SES parents. And that's what, we're still waiting for more data to be able to evaluate that statement. And that's, I think, part of the budgetary trade-off in Sacramento right now is, do you do this as a broad social policy for everyone, or do you really target raising this 100% wage replacement for some targeted income groups? Yeah. Chris?
So I was really struck by the responses to the hypothetical question about if you had 100% paid leave for 12 weeks, and that the high earners were much less likely to report that they would follow through with that. Yeah, I'm wondering how you think, or if there's some connection between that and the differences estimates of high versus low wage employees responding to the mandate or to the ordinance.
Yeah, so I do think that it's the case that that high wage earners are more likely to actually take up that full 12 weeks, partly because their employers are going to be supportive. And the low wage earners, some of them are just not going to take it because they're worried that there is going to be retribution, legal or not, at work if they try to take their full leave. Yeah, I think that they're both coming from the same place, yeah.
Yeah, now that this would affect your estimates of how much it costs to actually spend on the program, but do you have any idea of what the cost of implementing and administering the program are for these employers?
So we don't have actual dollar amounts from any employers. We try to collect that, and we could do that in I think some in-depth interviews, because you really need to do a lot of probing to be able to collect that. You can't really do that on a structured questionnaire very easily.
So leave take-up increases are overwhelmingly male. Questions are overwhelmingly male.
Okay, I have a question. It's back to this thing about whether employers will try to game the system by not hiring women of reproductive age. So first of all, would they also be suspicious of men at the life cycle stage when their partners are likely to be having? So that's one question. And the second is related to it. It seems to me that what's weird about the way this is financed is the very uneven effect on different kinds of firms. So if you're a firm of 25 people and you have half your staff, or indeed 100% of your staff, are basically young women, as is true for many kinds of organizations, it could actually have a devastating effect if 3 or 4 of those in 1 year.
Yeah.
So what are
Yeah.
is there a way to look at the various,
Yeah.
that seems to me to be, as opposed to some kind of payroll tax or something.
Yeah.
Finance.
For the first question, all the anecdotes of what people talked about, worrying about, cheating, these labor market effects, or they be discriminatory, all the anecdotes I've heard around women, for better or for worse. Maybe it's harder for firms to predict ex ante, who's, some kind of partnership and what the age of their partner is, and I don't know. With regard to the second question, I'm sorry, remind me of
The variability.
across the firms, yeah. I think that's a huge concern to me. In our data, we have some information about the labor force composition of the firm, so we can try to dig into that. We have limited ability to dig into different segments of our data, but I think that's one of the biggest downsides to an ordinance like this, that puts the cost directly on the individual employer as opposed to a disability insurance mechanism that essentially is a broad-based tax which spreads the cost across employers. It's interesting, as in Washington DC, I was talking to them last year about their debates about what to do. They had started with the idea of a broad-based tax, and they said, well, we had heard in San Francisco, you're actually just pushing it on to the employers, how is this working out? And this is one of the things I said to them. I said, I don't see it as a better approach to put this unfunded mandate onto employers. It can be very distortionary. And ultimately they sort of backpedal on their whole idea for other reasons.
Okay, we have time for one more question. Dennis Malman, you guys both.
Go ahead, Malman.
So I'm curious about so in terms of the folks who aren't taking the leave, and so we have one kid who's sick for the first time this week in 4 years since we've been back in the US. And I'm like, wow. And other folks have, kids who have been sicker and stuff.
Yeah.
And we realized, just the quality of our job being that we can actually work, still not get sick. And so do you have any questions in the surveys of the workers, or maybe looking forward to somehow get at, because I don't think it's just about paid parental leave, but that's a specific moment in a child's life, but it's like going forward, how workers actually deal with having family, young kids in their...
Yeah, so this is a larger question about paid family leave in general, not just parental leave, and some of the discussions in California, what they're talking about is not focusing on just the parental leave, but actually expanding the generosity for all parents, which I think is important to do. As part of this project, one of the next steps that we're doing, we're working on starting recruiting families who have a newborn in the NICU.
Yeah.
Because kids can spend just weeks and in extreme months in a NICU, and it can be absolutely devastating for the ability to work. So we're trying to do some focused, in-depth interviewing with families such as that to really understand their experience and help us think about how we can build out a larger research project around them. I think it's a great question.
Thank you, Will.